We hear all the time that, look, he's got an excellent level of clinical knowledge, but he just is not been able to package and present it well.
The main issue that we find with the IMGs is the communication side of things, because medicine essentially is the third language.
Hello, my name is Dr. Rizwan Qureshi, and I love making videos to enable IMGs to get the best out of their professional careers. Since I've been in Australia, I've been supported by a number of different people, and one of the most key person in that journey has been Dr. Peter Smith. Now, Dr. Peter Smith helped me pass my emergency fellowship exam back in 2015, helped me develop some of the communication skills in terms of non-verbal and verbal communication skills for emergency medicine exam. He also coached me when it came to interview techniques. And I had a very candid conversation with Dr. Peter Smith, in which I'm asking him about, what are the specific issues when it comes to shortlist international medical graduate for a job interview? What are they looking for in a job application form and a CV? What are the key issues that they're looking for in an interview in terms of performance? What is that they really want to hear as a group of consultant or people who are going to have a job offer given to an IMG? And finally, when the IMG is taken up in a training program and finally in the last year of their training, and they're now about to take their fellowship exam, what are the really important skills to have to pass the fellowship exam? That is in addition to your clinical knowledge. Because we hear all the time that, look, he's got an excellent level of clinical knowledge, but he just is not been able to package and present it well. So what are those key communication skills and non-verbal communication cues that an international medical graduate should utilize to stand a best chance of passing a fellowship or a specialist level exam? So without further ado, over to you, Dr. Smith.
Peter, this video is mainly about IMGs. Most of the IMGs who are looking for their first job, when they find their job, the challenges they face on their first job. And I just want to basically get an idea from you in terms of the whole process. Firstly, about the application form. What are you really looking for when you're going through an application, especially from an IMG, that this is a candidate that I'd like to shortlist?
One of the critical bits about any job application, whether it's from an IMG or from a local graduate, is how it's presented, the professionalism of that application, and ensuring that it makes sense, that it answers the questions, that the grammar is correct, that the spelling is correct. It is really disheartening to receive an application that shows no understanding or little understanding of what's going on with the way that we present ourselves professionally. But ultimately, this is something that is designed to reflect what you are. And if it's presented in an untidy and an incorrect fashion, it doesn't reflect well on the person that's presented it. The next thing we want to look for is the content of it, to decide whether in fact we have something that is equivalent in terms of training. It's difficult for us as Australian consultants to understand what emergency medicine is like in some of our overseas countries. And we have to rely on what is written in the application to give us some idea of equivalence. And then the third thing, I guess, is that we've got a breadth of experience that has relevance to the practice of emergency medicine. And that would be the final sort of component when it comes to the applicants. And then enabling us to decide whether in fact this is someone that we would like to interview.
Now, Dr. Smith, what about the interview? When the candidates are finally shortlisted and have now been invited for an interview, what are some of the things that you're looking out for and you consider that they're important for them to have a successful outcome?
Ideally, and I may be old school here, but ideally we'd like a face-to-face interview. It enables us to see the person, to actually get that interaction, that personal interaction that is so important when it comes to whether you can work with this person or not. When they do turn up, hopefully you've got someone who is professional, who is dressed appropriately, who is respectful, but has also been coached in how to relate to the individuals in the interview panel. It can be quite intimidating. I have no hesitation in suggesting that. I've been on both sides of the table on a number of occasions. You've got a couple of individuals who are highly credentialed and perhaps a little intimidating, not necessarily giving too much in the way of emotion, and you're trying your best to present the best possible image of yourself. We want people to give answers that are real, that are not necessarily book-based. It's important to have that knowledge, but we're looking for folk with experience. And the best way, I think, to display the level of experience that you've got is to actually give examples, regardless of the question. Give examples that you've got from your own practice that says that I've seen this, I've done this, this is what I would do, this is how I've done it in the past. Be open, be honest. We can tell fairly clearly if someone is coached via a textbook and hasn't had the experience that we're after.
You've been working as a senior emergency physician for a number of years. I have myself worked as your registrar and you've taken me through the fellowship exam. So you've been a mentor to me and I'm sure many other emergency physicians. Tell me some of the things that you look out for in an IMG when they're working with you on the floor. What are the particular challenges that you think they face and how can they overcome some of the challenges?
Another very good question. The main issue that we find with the IMGs is the communication side of things, both written and spoken. You will learn what it is to practice medicine in the Australian system. You will learn that there's an interaction, a team that is required with nursing staff, with clerical staff, with medical staff, junior, senior medical staff. Everyone has a role and is respected in what they do, be they male, be they female, but no one can function if the communication is poor. Communication is critical, and that requires the individual, the IMG, to actually be proactive in that front, to ensure that what they're saying is relevant, is real, and can be then translated into something written that is, again, relevant and appropriate for the patient before them. We need to be able to paint a mental picture listening to the individual that's speaking to us. So that's important when it comes to the presentation orally. We need to also paint that mental picture when we read someone's notes. We have to have clear direction as to which way they're headed, what they think is going on with the patient, and the appropriate management and disposition. That'll come through experience. That'll come through being, as I say, proactive. It's of no value sitting back and letting things flow past you. You have to be able to step up and have the conversation with your registrar, with your consultant, so they can listen, they can direct, they can guide, they will give you feedback, and if they don't, seek it. It's very important that you are proactive in that regard.
Now you have assisted many of the candidates through the various exams, especially the fellowship exam in emergency, and do you think the reason that some of the IMGs find it particularly challenging, is it because of the breakdown in their communication skills despite having adequate knowledge?
I take my hat off to anyone who can get through medical exams and get to the fellowship exam when English is not their first language, because medicine essentially is the third language. And it's a really, really difficult sort of interplay. Much of what's going on with medicine now is the interpersonal relationships. That's what's being assessed. That's what determines the quality of a doctor, their capacity to understand the emotion, to understand the psyche of the patient, and to then discuss that and present that to someone else. Empathy is a big part of it, and empathy comes through actually showing that you understand and reflecting that back. That is a significant problem. It's not something that you can necessarily teach. It's something that you feel, but that feeling then comes out in the way that you speak, in the way that you communicate, the way that you interact. The cultural differences we would accept as being, there's no dismissing that the cultural differences exist, but the cultural differences are something that you as an individual IMG can work on. The communication side is what requires so much diligence and so much practice, and it will be the shortcoming for some folk who make it all the way to fellowship exam, because the communication is one of the key fundamentals that we look at when we come to deciding whether this person is going to be able to practice as a specialist in years to come.
Peter, in a nutshell, you think that for an IMG to really consolidate their communication skill is by way of practicing, talking more to their colleagues, to the consultant, and to the people in community. Do you think that might be one of the solutions?
Any opportunity you have to have a conversation, whether it be in the tea room, whether it be in the corridor, whether it be with the clerk, whether it be with the receptionist, whether it be with the individuals that serve you in the supermarket, any opportunity you have to have that conversation so that language becomes automatic. But from a medical perspective, you need to have that conversation in a medical context with someone who has the time to listen and has the time to feedback. And you will be expected to present cases. That'll be part of your everyday practice. And if you cannot do that, then you won't progress in the field of medicine.
Thank you very much, Dr. Peter. Thanks for your time.
It's been a pleasure.
Appreciate it.